Client safety. Client safety is considered a basic human need. Healthcare has to be provided in a safe manner. It's essential for a client's well-being. A safe environment will reduce the risk of accidents and helps to contain the cost of healthcare. A prime duty for nurses is to protect clients from harm, to keep clients safe. A client's environment will include both physical and psychosocial factors that influence the life and survival of the client. Environment will include all places where the clients receive care, such as the home, community center, school, clinic, hospital, and long-term care facilities. Safety needs to encompass both the client's and the healthcare provider's well-being. Excuse me. Carbon monoxide is a colorless, odorless gas. It's imperative to check that furnaces, heaters, stoves, and ovens are functioning properly. Installing a carbon monoxide monitor may help save lives. Low concentrations of oxygen can cause nausea, dizziness, headaches, and fatigue. But high concentrations of carbon monoxide can cause death within 1 to 3 minutes. Nutritional support is one of a human being's basic needs. Therefore, food has to be stored, refrigerated, and prepared appropriately. Clean drinking water is a must for food preparation, cleaning, and drinking. E. coli, Salmonella, Shigella, and Listeria organisms are the common causes for foodborne illnesses. Normal environmental temperature range is between 65 and 75 degrees Fahrenheit. Hyperthermia occurs when the core body temperature exceeds the normal core body range. Excessive body temperature can cause heat stroke or heat exhaustion. The elderly, chronically ill, and young are susceptible to variations in environmental temperature. Hypothermia occurs when the core body temperature falls below 95 degrees Fahrenheit. Frostbite is a hazard of hypothermia. Consumption of alcohol, illicit drug use, and smokers are at an increased risk for hypothermia injuries. And humidity refers to the amount of water vapor in the air compared with the maximum amount of water vapor that the air could contain at the same temperature. Humidity can increase the effect of heat or cold on the body. Different physical hazards. We need to be aware of all of these and more. Adequate lighting will reduce physical hazards. Lighting should be examined inside the house of the patient as well as outside, which will include walkways, porches, garages, and pathways, not to mention in the healthcare facilities. Inside the home, adequate lighting should be examined in the hallways, staircases, closets, bathrooms, and individual rooms. We have to be aware of obstacles. Normal objects can be hazardous to those that have disabilities such as visual disabilities, hearing, or physical disabilities. You never block fire exits, hallways, or doorways with obstacles. Different accidents. We look at bathroom hazards. There's a new movement not to flush unused medications down the toilet. And many pharmacies, because of this, are now accepting outdated medications for proper disposal. This does not change the ecosystem. But we also need to be aware of wet floors, showers, and or bathtubs, because these are increased areas of risk for falling. Automobiles, your motor vehicle accidents, rank among the highest among causes of accidents. Make sure that the clients wear the seat belts, and if the client is under 2 years old, the rear facing car seat. They need to be encouraged to wear helmets when bicycle riding, motorcycle riding, skateboarding, etc. Aging causes risks because of memory or poor eyesight and mobility. Then we look at security. It's far-reaching and should be of paramount importance. The elderly and young are extremely susceptible to fires and poisoning. Proper storage of medications, chemicals, matches, and lighters are very important. And again, encourage smoke and carbon monoxide detectors. Transmission of pathogens can be minimized by proper hygiene. Immunizations can also reduce or prevent disease transmission from person to person. Active immunity will occur when a person receives an injection, and passive immunity occurs when the body produces antibodies to the pathogen. Pollution contributes to an unhealthy environment. A pollutant is a harmful chemical or waste material that's discharged into the water, soil, or air. Flooding also contributes to water pollution, and water pollution can occur in lakes, streams, rivers, or any body of water. Noise pollution will occur when decibels exceed acceptable levels. In healthcare facilities, noise pollution can contribute to sensory overload. Children, teens, and adults should also be aware that the use of earphones for music can contribute to hearing problems. Natural disasters such as flooding, tornadoes, hurricanes, earthquakes, extreme heat or cold. Again, you need to be aware of appropriate safety measures. The elderly and very young, once again, are the most susceptible due to mobility issues, thin skin, etc. Terrorism and bioterrorism are real threats. Biological, chemical, and nuclear weapons could be the cause of attack. It can be narrowed down to threats from biological agents such as anthrax, smallpox, the pneumonic plague, or botulism. Nurses need to be prepared through education and training to respond and treat clients if such an incident occurs. A lot of facilities these days incorporate a specially trained team that heads up potential bioterrorism threats. Education will bring a sense of power when dealing with the unknown. Bioterrorism attacks may never occur. However, healthcare facilities have policies and procedures they follow, and you have to review your healthcare facilities' policies and protocols. Every facility should have policies on appropriate protocol for fire, natural disasters, violence within the facility, etc. For example, remember RACE for fires, rescue, alarm, contain, and extinguish or evacuate. Never use the elevators, make certain fire doors are shut, be aware of flammables such as your gases, oxygen, chemicals, etc. With tornadoes, make sure you close window blinds and curtains to minimize flying glass. Close the doors, evacuate clients to designated areas, take pillows, blankets, and stay with the client. With violence, you need to make sure you protect the clients and visitors. Never try to be a hero or block a violent person's exit. And make sure that you notify security and or police as soon as possible. In the event of a natural disaster or fire, practical nurses provide client care on the unit they're working on and or complete actions as directed by their supervisor or the registered nurse. Remember, in the event of some of these disasters, client charts should be kept with the client as possible. It's important to have a strong foundation to help you create a safe client care environment. The client's development stage will create safety hazards that give rise to lifestyle, mobility status, sensory impairment, and safety awareness issues. Through all developmental stages, you need to be alert to signs of child abuse, elder abuse, and domestic violence. Again, you are a mandated reporter, so you will be held liable if you do not report suspected cases of abuse. With developmental levels, there's safety risks that many risks are applicable irregardless of age, but there are some that are specific to developmental ages. If you look at the infant, toddler, or preschool, injury is the leading cause of death over 1 year of age and causes more death and disability than all diseases combined. The thing about it is accidents are usually preventable, and parents need to be vigilant with supervision. With school-age children, these kids need to learn safety practices in home, school, and at play. This group of children also needs to be educated about the risk that strangers pose, learning not to accept candy, gifts, or rides from these strangers. And at this stage, since children are expanding their sports abilities, they need to wear proper safety equipment, and this includes helmets, gloves, pads, etc. that are appropriate for the activity they're involved in. Adolescents are more at the risk-taking behavior. They're gaining an increased sense of independence and a sense of identity, so they're more susceptible to peer pressure and influences, and they're more prone to experiment with drugs, smoking, and alcohol. As they begin to drive, this creates another set of safety issues, such as drinking, seatbelt use, speeding, or reckless behavior. Friends, phones, radio, etc. have been proven to increase the chance of an accident with an adolescent driver. Adults, lifestyle habits are some of the biggest risk factors. Smoking, drinking, drug use, and cardiovascular and pulmonary disease threaten to shorten our lifespan. Stress, anxiety, fatigue also influence actions or lack of action or thought processes. Older adults, we look at medications and diseases. Older adults will experience physiological changes that can cause issues. Sight, hearing, and reflexes are reduced, and this affects everyday activities. The decrease in sensory acuity will make injuries such as falls or burns more common. Sensory or communication impairment will affect those with visual, hearing, tactile, or language barriers. These clients need special consideration to prevent injury or trauma. Impaired mobility can be caused by muscle weakness, paralysis, poor coordination, lack of balance. These increase the risk of falls and hamper independence. And the last factor deals with lack of safety awareness regarding medication storage, medication expiration dates, expiration of food products. These factors remain relevant through the entire developmental lifespan. Nurses need to be vigilant to prevent these risks from occurring in the healthcare facility. Most of the previous hazards in the physical hazards slide are applicable in the healthcare facility, and you always need to be alert for potential safety issues and take care of the issues as you are able. Medication errors account for 60% of all errors. You must always follow the 6 rights of medication administration. Following medication errors, infection, bed sores, and failure to diagnose and treat in time round out the list. Various chemicals used in healthcare facilities contribute to safety issues. Mercury, anesthetic gases, and cleaning solutions have to be safeguarded and used according to protocol and procedures. Any incidences of misuse must be reported on the appropriate forms. For those clients over 65 years old, falls will account for 1.8 million visits to the emergency department every year. The falls will occur due to poor eyesight, weakness, and environmental hazards. Client inherent accidents are classified as self-induced cut, injury, burn, ingestion or injection, self-mutilation, or setting fires. You need to ascertain if a client inherent accident is caused by seizure activity. Clients that have seizure disorders oftentimes sense an aura prior to the seizure, and during the seizure the person may experience difficulty breathing, cyanosis, and or loss of bladder and bowel control. If a client has a seizure, then you protect them from further injury. Never put your hand or finger or anything in their mouth. Turn them to their side as soon as the seizure is over. Pad their head or move items that they might injure themselves on. Procedure-related accidents will occur during therapy, and they include medication administration errors, IV therapy error, improper use of external devices, or improper performance of procedures. Equipment-related accidents will result from malfunction, disrepair, or misuse of equipment. Make sure that equipment has been well maintained and undergone a yearly safety inspection check. Special risks in healthcare settings, again, include medication errors. Medical errors are the 8th leading cause of death, with medication errors topping that list. Infection, inappropriate identification of clients. We also need to improve staff communication. Infant abduction is another special risk in the healthcare setting. And again, falls. You've got to help reduce or prevent the risk of falls. Side rails may need to be raised, but if you raise all 4 side rails, that can constitute a restriction of client movement, and it's considered a restraint. Using alarms is a helpful safety device that can alert the healthcare personnel when a client is trying to get out of bed. You have a bed alarm or a tab alarm or a chair alarm. Restraints might be occasionally called for, but their use will require specific indications, and they cannot be used indiscriminately. There are standards that we have to follow when we apply restraints. Restraints was gone over more in depth in the ambulatory device lecture. Fire, poisoning, and electrical hazards pose that great hazard for clients in the healthcare facility, and nurses have to be judicious to prevent these occurrences. If there is a poisoning, always call poison control and follow their directions. Understand that it will usually mean a trip to the emergency room. And again, we also have to be aware of the client's cognitive awareness. Hand hygiene. We have to be very diligent in providing or practicing appropriate hand hygiene. Understand your isolation precautions when you are dealing with your clients. Standard precautions are to be used with every client in every situation. You can use minimal equipment, which would be your gloves, and you can add additional equipment as needed if you anticipate splashes with body fluids. Remember your aseptic technique. Medical asepsis is clean. Surgical asepsis is sterile. Involve critical thinking as you are dealing with safety issues. Always be on the lookout for potential dangers. Looking for cords laying across the floor, for spilled or wet spots on the floor, for areas that are blocked by obstacles, etc. And use the nursing process when planning care. Assess. Make sure that you are looking at the entire situation. What is it, a potential danger? What do I need to keep in mind with this particular client? Is this client a fall risk? Is this client cognitively aware? Is this client able to follow directions? Is this client able to participate in activities of daily living safely? Look at the medical diagnosis and determine the appropriate nursing diagnosis. As you're planning, again, take into consideration how much assistance might be needed, etc. Implement your interventions as we have discussed prior in this slide show, and then evaluate to make sure that the client has come to no harm, that there was nothing different that could have been done. Change the nursing process as necessary to prevent further injury. Risk management is also something that you want to consider with your evaluation. If there is any injury, everything goes to risk management so they can review it appropriately and determine if additional safety measures need